let's progress right on then. What are the symptoms? If we're going to make the diagnosis, whether it's correct or not, we're going to test for it. Clearly something's going to trigger you to go looking for this. What are the symptoms associated with the initial acute Lyme disease?
The initial acute presentation is a flu-like illness that occurs within 3 days to 3 weeks of the tick bite. That may or may not involve a rash. Most people think of this bullseye erythema migrans rash, but in some studies, on average, 50% of people will not develop that rash.
So good luck using that as an absolute marker.
Right, and the majority of people with bona fide Lyme don't remember a tick bite, so it's a challenge in that respect as well. But it usually occurs, the most common, there's a seasonality to it, such that between April, May, and September is the peak of the nymph feeding, and that's when it's most common to develop this flu-like illness, sore throat, low-grade fever, muscle aching. Without treatment, it will resolve on its own. The problem with that is that it can then result in more chronic manifestations that are well recognized.
And we're going to go on to talk about that as well. But
the term chronic, I think, is often used and perhaps sometimes misused. There are later manifestations of Lyme disease that are not necessarily chronic. There are chronic manifestations of illness that are a matter of debate, and I'm sure we'll return to that.
But is that syntax or is that medicine?
Well, later means it follows the tick bite and possibly the erythema migrans, if in fact it happened.
Okay.
So the sort of classic description of Lyme disease, and a lot of people have difficulties with this, is that there's early disease and then there's late disease.
Okay.
And the term late was what was originally used to describe cardiac disease, neurologic disease, and musculoskeletal manifestations, which don't necessarily persist, which would be chronic. They occur later. So I think I think there's less of a value added to it.
Well, I think that the syntax makes a difference, and I do want to get into it, because if what you mean by chronic is that there's persistent infection that needs to be treated, if it's late, which are not necessarily active infections, but some sort of immunologic response, that's different as well. And I know you want to say
Well, there's a distinction between chronic infection and chronic symptoms. And in most diseases, chronicity usually means after 6 months. If something's there 6 months, that's the way a lot of diseases are categorized.
And what are the psychological issues here?
Well, the more common things, the earlier symptoms or more mild cognitive impairments that increase, often slow processing, hypersensitivity to sound and light, and then executive functioning problems, and then you can see depression, anxiety, sleep disorders, you can see suicidal risk, and then you can see much more extreme things. Now you're looking at things that evolve years after the infection. So this is the later stage manifestation of the disease, and that's usually the people that I see, people that are 10 years out.
And I'd like to make a comment with respect to chronic active infection.
Okay.
I published a paper in 2011 whereby I believe I provided clinical evidence that was statistically significant that the majority of my patients, 209 patients who had blood tests that were negative for Borrelia, but presented with international case definition of chronic fatigue syndrome, and there were other markers that were suggestive of infection. I treated them with antimicrobials, and 62% improved to a statistically significant degree to a p-value of 0.0002.
Okay, so I want to get to that.